Hello, sir.
Hello.
Hello, sir.
Hello, Dr. Rutuja.
Wait a second, sir.
Yes.
Okay.
Okay,
Shall we
ma'am?
start?
Yes. Why not?
Yes, yes, ma'am. Merry
So,
Christmas, ma'am. Merry Christmas, sir.
Merry Christmas to everyone.
hello, good evening, everyone, and Merry Christmas. Today we are back with a live session at Healer's Corner, and we have with us our guest speaker, Dr. Rutuja Lonare, who is an intern in DKMM College, Sambhajinagar, and Dr. Kamlesh Kakde, sir, who has been practicing homeopathy since past 16 years in Nagpur, and has gained his fame in treating most difficult pathological cases. Let's start the session. Over to you, Dr. Rutuja.
Thank you, ma'am.
Yeah. Okay.
I'll start, ma'am.
Yeah, sure.
Okay. Thank you, ma'am, for giving me this opportunity, firstly. And first question to you, sir. Hello? I'm audible, ma'am?
Yeah, you're audible.
Okay. First question to you, sir. What our today's topic, winter asthma. Okay. What is So my first question to you, sir, what is asthma and what are the common signs of asthma? Hello?
So
Sir, yeah.
your video is freeze and you're not audible. I think there is some network issue. Yeah.
Is this good?
Yeah. Yes, sir.
Okay. So, yes. So, today's topic is asthma, right? So, we need to understand um, our physiology, anatomy and physiology of respiratory system. So, basically, our respiratory system is like a tree-like structure. Means there is one windpipe, and then there are branches, smaller branches, and again there are smaller branches, and which are called as bronchi and bronchioles. And at last, there are balloon-like structure, which is called as alveoli, right? So when we inspire air, then these alveoli uh, they swell like balloon, and then when we expire air, then they squeeze this air. So basically, what happens that because of some allergens, we have this hypersensitivity reaction in this respiratory tract, and because of that, this respiratory tract becomes narrow. This respiratory tract becomes swelled, inflamed, and it produces mucus. And because of that, there is difficulty in breathing, there is cough, there is chest pain, and wheezing sound. So this is called as asthma. So basically, asthma is a hypersensitive reaction of respiratory tract.
So why does asthma worsen in winter mostly?
So there may be lot of factors which causes to increase this hypersensitivity reaction in winter. Like in winter, there is dry, cold air, right? And this dry,
Yes.
cold air, this actually irritates our respiratory system, our alveoli and bronchi, mucous membrane, and in turns, it triggers inflammatory process, hypersensitivity reaction. And because of that, there is inflammation and production of mucus and asthma worsens. Secondly, this hypersensitive immune response is triggered by weather changes. So whenever there is weather change, asthma triggers. Also, in winters, there are a lot of respiratory illnesses like cold, flu, cough, and because of these acute infections, also asthma may trigger. We in winters we generally live inside indoors, and there are a lot of indoor allergens, and these indoor allergens may also cause asthma to trigger. There are a lot of drugs which causes triggering of asthma, like um, there are some NSAIDs, non-steroid anti-inflammatory drugs, or ibuprofen. These drugs may cause uh, increase of asthma symptoms. And in winter, there is also some changes in barometric pressure. So these are some factors which may cause or increase intensity or frequency of asthma symptoms in winter. So that's why we need to be very careful uh, during winters, because of asthma is more during winters.
What are the prevention and precautions should take, sir? Asthmatic patient mostly.
Basically, we need to avoid all these allergens. We need to protect ourselves from cold. We need to protect ourselves from dust or some other allergens, because it is allergic reaction. So basically, we should be
Mhm.
uh, away from allergens, which is practically not possible. So what to do? We should um, increase our resistance power, or somehow set our hypersensitive reaction, which is more. So we need to calm it down, cool it down, and we need to decrease its state its reaction. So this is the way, because practically we cannot avoid each and every allergy. Dust is all over around us, especially in country like India. So we need to increase our resistance power. We need to set our hypersensitive reaction. These are the ways how we can prevent or we can manage asthma. Even we can cure asthma. These are the permanent
Sir,
solutions we can.
sir, there is any psychological reason, sir, behind the asthma?
Um, Up to 20th century, it was called as psychosomatic disorder. So definitely,
Yeah.
asthma is triggered by some psychological factors, some psychological conditions. So psychology is always associated with our bodies. And as we know that
Mhm.
each and every disease is produced by PNEI axis. PNEI axis means psychology, neurology, endocrinology, and immunology. When there is disturbance in this PNEI axis, then any disease happens. So basically, our asthma is disturbance of immunology. But why this immunology disturb? Because there is disturbance in psychology. This psychological disturbance disturb neurology. This disturb neurology disturb endocrinology, means hormonal system, and disturb hormones. Imbalance in hormone causes disturbance in immunology. So this is how asthma develops. So there is connection of psychology with asthma, but there is connection of our emotion with each and every disease we have, right from the cold, coryza, fever, acute fever, up to the big gross pathologies like cancer. So we need to understand this holistic approach of understanding of disease process. Then only we will be able to treat this disturbance, this inner disturbance. Because treating just superficial symptoms of asthma will not help patient in long terms. It may help for temporarily, but in long terms, we cannot cure this disease unless and until we cure the PNER axis disturbance. So definitely there is psychological connection between symptoms of asthma Uh, yeah.
So how can we cure asthma completely by using homeopathic medicine?
Yeah, so we first of all we need to understand the holistic concept of asthma or any other disease. And when we do that, then we need to find a medicine which will act and which will cure the disturbance on this PNEI axis. And when we do that, then only we can cure asthma. And homeopathy is the science which acts holistically. It considers mind and body together, right? So
Yeah.
when we treat any disease, any patient rather, so we consider mind symptoms, physical symptoms, the patient as a whole. And when we do that, and when we consider medicine holistically, then that medicine actually recorrects the disturbance on this level. That medicine is able to decrease the hypersensitivity of our immune system, and then only in that way only we can cure asthma. I have a lot of patients of asthma which are completely cured with homeopathic treatment. So complete cure of asthma is possible only through homeopathic medicines.
So homeopathy is the best science.
Yes, definitely. When we practice homeopathy on the basis of principles given in the organon, on the principles of repertory and mantra medica, and when we consider organon and when we consider patient as a whole, and when we treat holistically, then homeopathy does miracles in practice. It it cures and it improves uh, very bad patients, very bad conditions also. But we need to understand the disease process in a holistic way, and we need to practice homeopathy in a holistic way. This is the only way by which we can cure most difficult or acute conditions also. So yes, uh, from experience of my 16 years of my clinical practice, I can say homeopathy is best uh, science, therapeutic science.
So any lifestyle modification recommended to the asthmatic patients?
Yeah, definitely. So we know that asthma is triggered by lot of allergens, right? So we need
Yeah.
to avoid these allergens. We need to keep our resistance power high by having proper nutritious diet, by doing proper exercises. We can, by living in very clean, neat environment, we can keep our resistance power high, and by this way we can uh, prevent or we can avoid the acute exacerbations of asthma, because asthma symptoms are not continuous, right? There are some episodes of asymptomatic episodes and period of a symptom, and there are some acute exacerbations. So it is not a continuous disease, but there is fluctuations, intermittency of symptoms. But we can avoid, prevent these acute exacerbations by keeping our resistance high, by avoiding these allergens, by doing proper exercise, and by having some nutritious diet. So these are the some ways uh, by which we can avoid asthma symptoms and its intensity. Clinically,
Okay.
we have found
Uh,
that there is connection of milk with asthma. So if patients having asthma, they avoid milk in their diet or rice in their diet. So it also helps patient to decrease the intensity of these acute exacerbations.
so how can we prevent hereditary asthma, which are passes on the future generation?
Yeah. So when we say that homeopathy is holistic science, so this holistic science, when we consider medicine like this, what I just explained, this medicine actually, we have observed this in many of genetic cases also, genetic conditions also, that these medicines improve or cure that genetic condition. So what it means that these medicines are actually able to reach at that level and cure at the level of genetics and epigenetics. So this is the only system which can um, reach up to that level and which can cure the disturbance even at that deep level. So when we prescribe these medicines, then we can actually break the cycles of these hereditary conditions, may it be asthma or any other hereditary complaint. I have clinically observed this in lot of my patients, that if patient has some genetic predisposition, then we can prescribe some medicine to the parents and we can prevent the passage of these hereditary conditions in next generation.
Ma'am, any question from you?
Mm, So you mentioned that we should make some lifestyle changes and we should do proper exercise, right? So can you suggest some exercise, lung exercises that would help asthmatic patients?
Yeah, so there are a lot of respiratory or breathing exercise like pranayama we can do. We can do inflation exercise, like we can inflate balloons, and there are spirometers which are available in pharmacy. So we can use that to uh, actually exercise our respiratory system. And we can acquire good lifestyle changes. We can have turmeric and jaggery in equal proportion. And if we can take it morning and evening, then this is also good antiseptic and anti-allergen. So this may also help in patients with asthma to prevent the acute exacerbation. At least this will reduce the intensity. And to cure completely, you need to take proper homeopathic treatment, and by that means you can completely cure your asthma.
Okay, sir. So thank you both for an amazing session today.
Thank
That's it from my
Thank
side.
you,
you,
ma'am.
thank
Thank
you
you, sir.
everyone. Thank you, Dr. Rutuja, for having us on Christmas Day. So thank you so much, and
Yes.
bye bye.
Bye bye, sir. Thank you, ma'am.
Thank you.
Bye.